Heart disease is the #1 killer of women in the United States, but when you're a healthy, vibrant 21-year-old, a heart attack is probably the last thing on your mind. It certainly was for Megan Johns, on the eve of her college graduation.
I had a pressure in my chest, and it felt like a stack of books was on my chest, resting. And then my left arm was tingling, and it felt heavy.
This seemingly healthy 21-year-old wasn't feeling like herself, but despite having recently given a class presentation on heart attack symptoms, Megan didn't call for medical help. For the next 12 hours, she went about her business, refusing to believe what her body was telling her.
I was vegan, so I didn't eat any meat or dairy. I worked out regularly. School was important to me, so I just stayed healthy, and it just didn't make any sense.
It didn't make sense to doctors immediately either. With no known family risk factors for heart disease, they surmised that a random blood clot due to birth control pills had caused the heart attack. But a series of tests at Cleveland Clinic uncovered the real culprit, a genetic biomarker called lipoprotein A, which occurs in about 1 in 500 people in the general population. Genetic markers for heart disease are rare, and according to some experts, their impact is still poorly understood.
It is a special type of cholesterol that actually increases the tendency to have heart attack and stroke by making the cholesterol sort of thick and more clot forming.
I was relieved to find out something, to just be able to know and feel confident that I know what's wrong and I can now take care of myself.
The entire Johns family was tested for lipoprotein A, and sure enough, Megan's mom carries the same biomarker.
I have a predisposition to high cholesterol, and even though I eat healthy, it's always will be elevated unless I take medication to do something about it.
It's an easy thing to do to just know what your risk is, and then if something ever happens, you can listen to your body and know what it's telling you.
3 years post-heart attack, Megan is thriving. She does take medications to keep her cholesterol in check, and an aspirin a day to prevent blood clots. But she's exercising regularly and volunteers for the American Heart Association, where she reminds others about the warning signs and risks of heart attack. For Everyday Health, I'm Christina Fiore.